All right, so I'm talking finance, so I decided to use a green pen. So today we're going to be looking at budgets, right? Budgets in a hospital. And there are three things that I think you want to kind of just think about when you're working through a budget. The first thing is your labor cost. And labor cost is basically how much dollars you're paying employees. And that not only includes the hourly, but it also includes benefits, okay? It includes the insurance you pay, and benefit ranges, call it anywhere from 15 to 30% of actual salary. Some people maybe 10%, but of their salary, you're paying that much more. It is a cost to be aware of. It's actually the largest part of any hospital. It's about 60% of your expenses as a hospital will be in your labor cost. The next is your supply cost. And supply cost includes everything from materials used on the unit to office supplies. And, you know, these are things that will increase if you have an increase in, say, patient volume. So it is important to note the units of service versus, call it, per unit cost. And, you know, in some cases, per patient day. There are different ways to look at it, but overall supply cost is truly important. So we talked about labor costs, we talked about supply costs, and then the third and last thing that you want to look at when you're looking at overall budget is what is the ratio of productivity, okay? And so the way you look at this is like, okay, if you've got 10 people working in a department, and those 10 people can care for, say, call it 60 patients, then you're talking a 1-to-6 ratio. Okay? And this is an example of a medical surgical unit. Okay? In some cases, 1-to-5, but a med surg. In ICU, you see more of a 1-to-2 ratio, one nurse to 2 patients, or in a med surg 1-to-6. So these three factors, labor costs, supply costs, and ratio of productivity, are factors that you should be aware of when thinking about a budget in a hospital. Thank you.